First, I'd like to mention two female characters, fictional characters, that I think should inspire us to think about both ADHD and autism as not always a disorder problem, but perhaps a difference. And both in Swedish and in English, there is a tomboy, this notion of women who are a bit male, different in the behavior. And in Britain, they also have a fantastic reality show called Ladette to Lady, where very impulsive and unruly young women are going to boarding school to learn good manners. And they are totally wild and crazy. The most interesting about that show is that never ever is it mentioned that their problems may be due to an ADHD problem, which to me as a child psychiatrist seems very likely to be a problem. And so the concern with women and essence problems is that we don't recognize it. This slide shows the rate of medication of ADHD in Norway. And as you can see, there has been a general increase both for men and for women in only 5 years, from 2004 to 2009. But the most remarkable is that women seem to catch up. So in children, there are far fewer women being recognized or medicated. But when it's 40 plus, it's just as many women as men are currently receiving ADHD medication. So are we recognizing these problems later in women, perhaps? In Gothenburg, there was a study, a very big study on girls with different kinds of problems. And the most remarkable about that study was that Svenny Kopp, who did it, she investigated all these girls herself, and they were referred for a variety of problems, social problems, hyperactivity, or dropping out of school. And even though they have had problems for a long time, many of them from the preschool years, they only got their diagnosis of autism or ADHD in late adolescence, after several years of severe problems. And they got it then because they met Svenny Kopp. Otherwise, they probably wouldn't have gotten it then either. And I asked her to see how can we recognize essence problems. I'm using essence, but I'm also referring, essence is sort of including both autism and ADHD and other things. So how can we recognize these problems in women? And she said, there are no shortcuts. We have to always consider these problems as underlying the underlying phenomenon when we see girls and women presenting with emotional problems, with behavioral problems, with developmental problems. In our own study in Bergen, we saw that teachers were very unlikely to rate girls as having a lot of problems with autistic symptoms or ADHD, whereas parents rated girls and boys more equally. And so perhaps parents are better at recognizing autistic problems and ADHD problems in girls, whereas teachers don't see it. And this is a problem, of course, because at least in Norway, children are often referred because the teacher has recognized a problem. And so girls are sort of losing out on one way to come into specialist services. If parents don't stand up and get help, there is no help for that girl. In an adult study from Bergen also, we saw that there is a lot of more women than almost the same amount of women as men. And these women are, the difference, subjective difference is that they seem to be very talkative. And they also they also report a lot of distress. They report higher symptom levels in their self-reports, and fewer of them were diagnosed in childhood and medicated in childhood compared to men with ADHD. the rate of depression and anxiety was very high, both in females and males. And, so it wasn't significant difference between males and females. But they more seldom had problems with drugs and alcohol than men, and had more often been treated for some other psychiatric disorder before they got their ADHD diagnosis. In a birth study looking at the properties of ADHD children, their mothers were more often single and more often unmarried than the controls. So there are some indications that even though in this previous slide the rate of anxiety and emotional problems was high both in men and female, there are other studies showing that the comorbidity of emotional problems and ADHD is even higher in girls than in boys. And I'm thinking, when we don't recognize these essence problems in girls, what happens to them as they grow up, unrecognized and undetected? If we look at personality disorder, this is diagnostic criteria again, but a lot of these things are, if you have an unrecognized neuropsychiatric problem, you fulfill the baseline criteria for personality disorder, which means that you should have a problem that has been lasting for a long time and exerts itself in many different aspects of your life. And if we looked at the symptom criteria for borderline personality disorder, which is much more common in females than in males, a lot of these problems are seen in people with ADHD as well. And so just by having ADHD, you can easily see that you would fulfill the borderline personality disorder criteria. And indeed, studies looking at this have found a very high so-called comorbidity between ADHD and borderline personality disorder. And so children with ADHD, they develop borderline personality disorder, and people with an established borderline personality disorder have a high level of ADHD symptoms. When it comes to autism, a lot of these adults with autism, they fulfill the criteria for obsessive compulsive personality disorder. And so one thought might be that the adult psychiatrist, seeing the patient without the history of the childhood, may view this as a personality problem, whereas it is something that we would think of as a neuropsychiatric developmental problem. Well, another so-called comorbidity between autism is with anorexia, and they share a lot of similar features in their way of behavior, like this strong rigidity and obsessiveness, very need of control. And some studies have looked at their abilities in theory of mind tests, and they seem to perform as bad as people with autism. Another study showed that these problems, when they recover from anorexia, they improve. So we don't know there are not so many studies on this. But I do believe, and I've seen a lot of people with anorexia, that at least in a subgroup, autism and autistic traits play a very important role. And so I actually was phoned up by a quite famous Norwegian artist who told me that she had been treated for anorexia for years and years and been going to psychoanalysis, but now her son was being diagnosed with Asperger, and she was very confident that she was in the spectrum herself and having those problems. And those were totally not known by the rest of the society or her treatments. And so another aspect of female essence is that females become mothers. And this is Britney Spears with expecting a baby and smoking. And so being a mother requires a lot of skills that are very difficult for people with essence. So to be a good mother and an efficient mother, you need to be able to tolerate some frustration, to plan ahead, and to regulate your child. And this is very difficult for a lot of people with ADHD and autism, in theory, I would say, because there are surprisingly enough no studies that I know of that has looked at what it means to be a mother and have ADHD. What does it mean for you as a parent? Not having a child with ADHD, but yourself having ADHD and trying to raise a child. And similar to that, we also do not almost anything about what does it mean to be pregnant and use medication for ADHD. And that is very surprising because, as I said previously, almost 0.5% of fertile Norwegian women now use medications for ADHD. And so they're very likely to become pregnant and use their medication. And so there are some case reports of methylphenidate, Ritalin, and pregnancy, but no studies of atomoxetine. So we don't really know what it does to the fetus at all. I have called this slide the unwanted pregnancies because knowing about ADHD and the impulsivity that people have, you would expect that girls with ADHD more often develop and get pregnant unwanted, and that are some studies on that. But in this adult ADHD study from Norway, I asked them if they asked the patients about this, and they didn't. And so we don't include these items as a measure of impulsivity or a problem. There are no questions about parenting issues. And I think that is because we have a male bias, not only in what we study, but also in our minds of how to perform the study. What do we look at? What do we examine? So we do seem, at least in Norway, to have a more focus on female problems now, but we still have a long way to go. And I'm not saying that symptom criteria should be should change necessarily, but what we should keep in mind is that a symptom criteria is just trying to describe an underlying phenomenon. So we are trying to assess impulsivity. And so we need to think, how would that impulsivity look in a woman, rather than a grown-up woman, for example, rather than a 5-year-old boy? Will she run around? No. She will probably be more restless. And so just the exact presentation of that phenomenon will always vary depending on culture, age, gender, level of functioning. And so in my own experience, girls are more likely to giggle and chat a lot excessively. They are teasing, they pull hair, they daydream. And a lot of these very perfectionist girls, they're very meticulous, so they get so slow because they're always trying to keep everything perfect. But we don't know about this. This is just me hypothesizing and thinking aloud of what could girl presentations look like. So to sum up, I don't know if I have used quite little time. The only way to find female problems is to look for it. We don't find anything if we don't think about it and look for it. And there has been a lot of development recently, at least in Norway, in this field. So people are interested in learning more about female problems. But we still need to do a lot of things, I think, and especially design studies to look at specific female problems. I think we always need to think twice, especially with females, because a lot of times their symptoms are less obvious, and they tend to take it more onto themselves. So in ADHD, for example, in the DSM-4 criteria, it says that you need to be objectively functionally impaired. Whereas for a lot of other disorders, it's enough to be suffering yourself from it. But with ADHD, you need to be functionally impaired. A lot of women that I know, they compensate to a very large degree for their problems with concentration, but to the expense of their own well-being. So they suffer with severe exhaustion and headaches and fatigue and so on, but nobody would think that they have ADHD. So if you meet an adult or a young person with emotional problems, social phobia, for example, you should always think that there could be something behind. As Gazioudin also said, that depression is very common, and social phobia is also very common in people with a slight degree of autism, if you will. I think personality disorder should always be thought about as a possible presentation of an underlying essence problems, and also with the dependency, but that is not especially for girls or females. So with social phobia, I just wanted to mention that I have currently a girl in therapy who's 11 years old, and she has clinically a social phobia, but also a very rigid kind of behavior, and she's very meticulous and quite slow. So in her treatment, it's very important to acknowledge her underlying autistic traits, but I will not diagnose her with autism because she's not very autistic, but I think it's important to bear it in mind because she has a sort of cognitive style, if you will, that will be better treated if you think that, if you bear that in mind, than if she didn't have it. But her social phobia is a main presenting problem. So it's always a difficulty, I think, with females, that they are more often in a borderline area, and so it's more difficult to know if you should diagnose something or if you shouldn't, and then how do you treat it. But I have myself resolved that many times by just telling the parent and the child about their tendency, so that they themselves know about it and can bear it in mind in the future of their lives. And so in English they say that autism, they call it active but odd. So odd is the Asperger odd. But in my own view, I find a lot of women are not odd, they are weird. And so thank you very much for your attention.